I request Dr. S.S. Kalyan Shetty, sir, Professor, Department Pediatrics, and Dr. Shri Gidaganti, sir, Secretary IAP Vijayapura, to escort Dr. V.D. Patil, sir, Director of New Project, Kehar, Belgavi, to the dais.
I request Dr. Shri Gidaganti, sir, Secretary IAP Vijayapura 2025, to address Dr. V.D. Patil, sir.
Good morning, all. So, myself, Dr. Shri Gidaganti. So now I take my pleasure to invite today's chief guest, Dr. V.D. Patil, sir. So everyone knows that today's topic is Vision 2030. So 2030 is very significant year because it is a sustainable development goal target. So at the same time, the today's speaker is also very apt for the day and the timing we are going through. So if we see the times, so we are in a transition society. So our ancestors had a lot of issues to meet the daily needs. So now we are exploring the to meet the needs wants of the life. So the life is moving towards. So 2 decades back, the care was very rare commodity. If the doctor is available, everyone used to be very, very happy. Now the availability of the doctor is a routine thing. Now the need of the thing is quality care. So that's why the challenges are evolving. So in Sanskrit, gu means it's a darkness, it's a ignorance. Ru means removing that ignorance. So guru means it's a guide towards the light. So guiding towards the light. So the law of nature, everything works in the universe as per laws of the nature. One law of the nature is everything changes. Nothing is permanent. So change is the law of nature, and change comes with the problems. When change plus problems become challenge, when we accept the challenge, we move on towards the next step. So these challenges, for every problem there is a solution. Without solution, there are no problems. These solutions are formulated by the experts. There are 2 types of experts. One is those experts who have read the book, they have the expertise. The other experts are experience-based experts. So the solutions formulated by the experience-based experts are long-lasting. They are good in theory, practice, and reality. They are the pragmatics. These days, there are too many medical colleges, too many medical seats, too many doctors. So there may be some agenda behind this by the government of India to meet the sustainable development goals. At the same time, the doctors who are coming from the medical colleges, they are in the phase of darkness, we may say, because they don't know what to do, how to do, where to do. So for this, we thought this topic is very relevant. Vision 2030, the challenges for the practicing pediatricians. So now coming to our chief the speaker, Dr. V.D. Patil, sir. So he's he's a very apt person. He is called teacher of teachers because he has both. Most of the time, the practitioners have either the academic interest or the practicing interest. But V.D. Patil, sir, has aptly managed the both academic side and the practice side, because yesterday S.V. Patil, sir, the Kalyan Shetty, sir, was telling. So his OPD starts morning at 6 o'clock. So to get appointment, the patient comes at 4 o'clock. So he finishes his OPD by 8:30, then he comes to the college and he does his academic activity. So it won't be wrong if we can say he is the one who started the idea of pediatrics in the northern Karnataka through his various roles in KLE. So like started as a lecturer, then assistant professor, professor. So chair, principal sir, dean of faculty, and so he has also conducted so many state level and national level conferences in KLE. So and he has published many articles and chapters in the very good reputed books. So he has been awarded the WHO fellowship so way back in 1990s, and he has done his MBBS from the Hubli KIMS, then DCH from Hubli KIMS 1969 to 1973, and then he has done his MD Pediatrics from my own college, Bangalore Medical College in 1975. So, sir is currently serving as a director of new projects for the KLE. So, he is in charge of the establishing a quality medical college in Hubli. So, without wasting much time, so I request VD Patil sir to deliver his talk. So, please, sir.
Can you remove this? Little heavy. Afterwards, I'll put again.
Okay, sir.
Sorry. I can give that. No, that is, this thing is there. It's okay. No, it's okay. It's okay. It's okay. Good morning, everybody. At the outset, let me thank the organizers, especially led by Dr. S.V. Patil, one of my favorite students, to have been invited to this college and to this organization to give this talk. Actually, I'm not new to this campus. I've been coming to this campus almost for last about 10 years. Since the inception of the university, right from the first Vice Chancellor, Dr. Jigjani, followed by MS Biradar, and now Dr. Mudhor. I've been the member of these academic bodies, including the Board of Management, and almost every month or 2 months, I come and we have had a very cordial relations with the BLDE University. And we both of us, KLE and BLDE University, we work together and we exchange our ideas, and we have a good rapport with each other. Now, coming to this topic of challenges in new millennium, this topic was told to me by Dr. S.V. Patil. I told him what has to be talked about this, because this is a very vague topic. Challenges can be anything. Challenges can be in terms of any infrastructure. Challenges can be in terms of the providing services. Challenging in terms of the producing the adequate manpower. So which one to be need to? Sir, as per your experience, whatever you want to say, you can say about the challenges which a pediatrician faces, and pediatrician will be facing in near future. Coming to the reality, this was almost about, I started my pediatric career in somewhere in 1970, almost about 50 years back. The days at that time and the days now, there's a sea of difference. Lot of difference there. At that time, the pediatrics was taken as a part of medicine, a small brother or a younger brother of medicine, or a very small brother of medicine. Almost about 15-25% of the medicine share was given to the pediatrics in all the aspects, including the question papers and all other facilities which have been given. And at that time, the disease scenario was so different. At that time, there was a scourge of the gastroenteritis. It used to come in a lot of epidemics, and to take away the tolls. There used to be epidemics of the poliomyelitis. Sometimes I remember in a civil hospital or in KMC, even we used to practice, entire one side of the ward used to be full of acute poliomyelitis. We used to call the doctors by phone. At that time, the phones were not there. We used to send the messages, stop giving injections, intramuscular injections. so that the cases will not increase. At that time, we used to get the case of neonatal tetanus. In the civil hospital, the isolation ward is almost for 1 furlong away from the morning building. Night time, you have to go in the pitch dark. You'll not be able to see even 1 feet away with a small torch, and in that the baby would be lying there. You have to search where the baby is there, and baby will be struggling, having convulsions. There's somewhere in the corner, the grandmother will be sitting, the mother will be sitting on the cot. You have to find out the baby. At that time, mind you, how to give the injection for the baby, how to set up a line for the baby, how to sedate the baby. So all those challenges were there, and luckily the tetanus slowly disappeared because the immunization status having improved. Same thing with the poliomyelitis also, thanks to the World Organization, the steps taken, the polio also has been eradicated. Gastroenteritis also with the improvement in slide sanitation and with the advent of ORS, the gastroenteritis also has become less. So with these things, now we have come up with the different types of diseases. Earlier, regarding the infrastructure, at that time the infrastructure used to be only hands and stethoscope. Only the hands and the stethoscope. Now the infrastructure which is available for the physicians, for the clinicians, is AI and a robot. You make use of the artificial intelligence, you make use of the robot and start working on it. As a result, one thing has happened, the facilities have improved, the infrastructure has improved, the doctor's job has become easy. But the more important is that rapport between the patient and the doctor has become less. Earlier, the patient used to talk to the doctors. The doctors used to talk to them. And as we mentioned, that the best way to make a diagnosis is to talk to the patient. By talking to the patient and taking the case history, it is said by Dr. B.M. Hegde in his book, what is not taught in medical colleges. 85% of the times you can come to a conclusion at the end of taking a correct history. Other 10% by examination, and other 5% you may be or may not be by your investigations. So that should be the clinical thing, which is now practically has become less now. Now, yesterday only we had a felicitation, the posthumously, for Dr. H.J. Desai, who was the doyen of who was supposed to be the pediatrician in 1970s, 60s, 70s. He was my teacher. He became my teacher. I joined under him as a undergraduate, then for DCS as a postgraduate. Then I joined him as a colleague in Jawaharlal Nehru Medical College. And then I occupied the same chair which he was occupying. I became the principal of the college. So I had a good relation with him. Yesterday, one of the videos of his was shown, where when the instruction ceremony was there during his lifestyle, that he was telling at the age of 90 years, he was interviewed by some of the senior pediatricians who were his students in Hubli. And he was telling that obviously the pain was obvious on his face, that how the days, how the patient care has come down. He says now the investigations, the history and the examination is done in 5 minutes. History examination is done in 5 minutes. The investigations are done for next 5 days. Investigations are done for next 5 days, and at the end of the 5 days, what treatment you are given on the first day continues to be there. That means what you have done on the first day, the investigations are honestly being done. So what he was trying to imply, what he was trying to say, and the same thing is there now. It is painful to see that the investigations are being done. Painful to see that the investigations are done first and then the examination is done. We see now in the OPD, a case with a murmur comes in the OPD. First, the child is sent for the echo, not even the X-ray, not even the ECG. Sent for the echo, and once the echo diagnosis come, then the retrograde diagnosis is this is there, this is there, this is there, this take up a murmur. Then you see the books, this kind of murmur to be seen. So now the diagnosis is by retrograde method. not by the prospective method. Earlier in nowadays, a case of murmur, congenital heart disease, the clinical discussion you used to go for 2 days. Go on saying we are discussing about the history, about the investigation, about the symptoms. Each symptoms go on analyzing, go on doing the examination. What kind of murmur he has got, where is the radiation, what is the intensity, what is the duration, how it is changing, and then the discussions go on because there are no investigative facilities. The only investigations which are available at that time was an X-ray chest or ECG. And the interpretations of that we used to go on doing that. And then sometimes somewhere in the end of the 70s, we used to send the patients for echo. So sometimes echo was available in Bangalore and Pune. And the diagnosis used to come. And then we used to celebrate, yes, what I had done clinically at that time, what was the correct thing. What I say to my student is, you celebrate it now. When the patient comes, you examine him, do the examination, come to conclusion, 5 or 6 of you, do the diagnosis, send him for investigation. And once the investigation comes, then whoever has done the correct diagnosis, there the celebration should come. That will develop a sense of the clinical attachment with the patient and the improvement will come. So these are the things which are to be done. Now I will be what are the scenario, what are the newer equipments which I just run through. Now the practitioners, the pediatricians will be dealing with next few years. Of course, now also they are dealing it of the genetic disorders. Now newer and newer genetic disorders. Now any case of any dysmorphism or congenital disease, maybe congenital heart disease or congenital anomaly or sense anomaly. Now it is expressed in terms of the chromosomal disorder, and the descendants and the genetic counseling need to be done. So the patients will ask about that. Patients will ask what the challenging thing will be. Only diagnosing will not be. The next question will be whether it will affect my child or not. Is there any my fault in that? All these things we need to answer. Pediatrician will have to be ready for that. There's a lot to be said about that, but I'll not go into the details. But these are the things which will be a big thing in the next future to come. This is another one important thing. We take the credit. I say many times neonatologist. We say a success of neonatologist is decided on how many grammar he has saved. Somebody will say, I've saved 800 grams. Somebody will say 600 grams. Somebody will say 900 grams. Okay, you have saved it. You have sent him out of NSU. He's become an NSU graduate. He grows up. But what is his quality of life? Has anything been done? His success of saving will come ultimately when he attains the normal milestones, at least at the age of 1 year, 2 years, or with the scholastic performance. Then only the success of that prematurity will come. So the prematurity with the newer available gadgets and all the available knowledge which I got, only saving the child is not going to survive. He is going to be a curse. That mother, that family will go on cursing you if the child is handicapped and is a burden to the family. Many times, mind to mind, they will be cursing you. Why did you save my child? And give a burden to me and to my family. So when we deal with that, this is going to be the main challenge, that we may save the small babies, but ultimately we are responsible for that burden which you are given to that family. Prenatal diagnosis and treatment. Of course, this is going to be born, especially with the genetic disorders, especially like cases like thalassemia and all. If the traits are very bad, then the terminations and all can be. There are many disorders which can be benefited by doing the prenatal diagnosis, and many of them can be managed antenatally also. Now, this is a new one which has been said in the recent journal. This trauma to the head of the children. Children go on playing, and they go on sustaining the minor injuries throughout the body, many times to the head. And many times the children are brought brought to us saying that the child has fallen like this, but there's no trauma, there's no obvious trauma. And we say nothing will happen, go. But these are the ones which may cause further problems. So one has to be little careful when we deal with the minor head injuries. They may be trivial, they may be taking with the household, but one has to be careful about that. Now, this is another one big one. This is something like a fashion. This is like a fashion. The introduction of new devices and new drugs, especially AI, artificial intelligence, is coming in a big way. And there will be an escape route also for the doctors. That anything you do, you can say, I've done account of artificial intelligence. There is an escape route for that. So artificial intelligence is one thing. It is sneaking into every field. Every field may be the instrumentation, may be the drugs, may be the investigations, may be the interventions. Anywhere the artificial intelligence is there. And this is still the complete scope is not clear. But this is the one which is going to play a lot of important role. Better for the children, better for the humankind, and many times it may cause havoc also. Telehealth is now become a routine, and this one now usually will have to be developed, and the clinicians and the pediatricians will have to be well versed with that. Same with the telemedicine. Nanomedicine is another one which will play a lot of role, which we have to be very careful about it. And these are the medications. These are the nanoparticles which are used for the medications or for the interventions or for the investigations. Same thing for the precision medicine. Now, this precision medicine is one wherein the treatment and the diagnosis, especially the treatment, can be done without affecting any other organ, especially now in the treatment of cancer. This precision medicine is used, and multiple equipments are available where a particular lesion in the body. Earlier, what used to happen was to give the drugs along with the malignant drugs, the other cells also used to get damaged. Now, with the precision medicine, the medication can go and localize only in those diseased cells, and the surrounding even one cell will not be affected. That is what is called as a precision medicine, and this precision medicine can be used for other diseases like the genetic disorders or other diseases also. Newer devices are discovered every now and then in every field, and they need to be used very judiciously for the benefit of patient, especially the robotic ones. The same thing is with the drugs. Now the ambulatory medicine is coming in a big way. That now the ambulatory care has become so important that many of the bigger hospitals are become empty now. Many of the departments are becoming empty. For example, the departments of ophthalmology, departments of skin, departments of ENT, departments of psychiatry. These are all going to be the ambulatory medicines, and the wards will be almost empty in near future. They are already empty now. So these ambulatory care in terms of cardiovascular disease or diabetes or giving the daycare management is going to come in a big way, and we have to be ready for that. Now, this is one more thing which is there: continuity in the management of pediatric age through the adulthood. Earlier, about 20 years back, we should say pediatric was only up to 12 years. Then we extended up to 15 years. Now, we have not kept the limit at all. From the day of conception to the day of maturity. Maturity may not take place at all. He may continue. So as a pediatric, we are very generous. We want to take everything because that period between 12 years to 20 years, that was in no man's land. That the patients were not knowing where to take him to the physician or the pediatrician. Physician will say conveniently, I don't want. Pediatrician used to say, I don't want. But we pediatricians became very liberal and said, we'll take it. And from the day of conception till the day of maturity, this will be there. So the continuity from one to other. This is happening to me now. I have been seeing the patients right from about 30 years to 20 years. They have become parents. Some of them, they have become grandparents. And they bring their children. the grandparent brings the grandchildren and says, sir, I was also your patient. And he says, some complaint and you can give medicines. I said, well, I'll not see now. No, sir, you had seen me at that time. Now also you see. So the continuity of the care, how to, and many of the disorders are there. For example, the allergic disorders, or the patients like thalassemia, or other patients of congenital heart disease who improved, a case of rheumatic heart disease. Now, I had some of the patients of rheumatic fever who were on long-term prophylaxis. They were continuing. They become 12 years old, 15 years old, 20 years. They cannot be accommodated on my table. I said, well, now you go to vision. He said, no, I will not go to vision. You have been saying to me right from the beginning, you see it now also. But the physiology changes, the anatomy changes, and we also have to be little more ethical. Whether the people will lodge complaints saying that this fellow is doing unethical practices, he is seeing the adults also. But the question is that the patients want that continuity to be continued in the same way. So this is the one management, and you have to tactfully manage that and see that you carefully transfer them to the adult side. Now these are the applications of nanotechnology. This is a great tool to play in the diagnosis, monitoring of the diseases, operating instruments, regenerative medicine, especially in the terms of developing vaccines and the medication delivery system. Now the pharmacy, Department of Pharmacy, not pharmacology, has got a great role to play. There's a course for probably all of you must be knowing, which is the Pharm D course. And these are the ones who deal with they are the ones. Now the regulations are there in the Western countries that if you have to give one drug, you can't give it on your own. It has to be through the pharmacy persons only. The pharmacy person has to come, he has to evaluate, he has to see, he has to calculate the dose, and he has to give the drug. Then only it can be legally given. Otherwise you can't give it. So in that, the drug delivery system, they are evolving. And in that way, the system will change accordingly. Now this is another one, influence of lifestyle of the parents. This all of you know that because of the nuclear families, because the both the parents being working, naturally the children slight amount, it may not be negligence, I say, there may not be enough for the 100% care may not be given, even 95% care might have been given, 90% care might have been given. But that itself may affect the child. Plus the surrounding area, the school surroundings, the teachers with the ambience of the school, and the peers, all these things now the thinking, if you have the children between 5 years and 10 years, you can make I need not tell it in detail, what is their way of behavior, what is their way of thinking, what is the way of acting, what is the way in which they look at the parents and try to interfere that. If you tell them something you should not do, their daddy is doing, why I should not do. If you ask them you should not do it, why mommy is doing, why I should not do. I've seen many of the parents bringing their children, saying that the child is behaving in an abnormal way. But if you go into the details of that, it is the fault mainly lies in the ambience of the house, the bringing up of the child, the behavior of the parents, and the presentation of the parents before the child. So all these things, especially the strained relations between the husband and wife, the father and mother, and if there are frequent quarrels are there, or if they are far away from the child for a long time. So all these things are the ones, and these are the ones will not get the case of fever, may not get the fever, but these are the ones in near future we are going to get. And for that, what is required? What is required for this? This does not require the medications. This does not require the hi-fi equipments or the nanotechnology. This requires the time on the part of the pediatrician to talk to them. And precisely that is what we are not getting. Unfortunately, that is precisely many times, again, the success of a pediatrician is told in terms of how many patients he sees a day. 5 patients, 10 patients, 50 patients, 100 patients. If I have seen 100 patients and he puts up his claw, but I should say he's a failure. He's not doing justice to the patients. The doctor should talk to the patients. Unless he talks to the patients, the rapport will not come, the patient's improvement will not be there. So, and especially for the lifestyle disease, lot of counseling is required, lot of detailing is required, lot of information needs to be taken from the mother, from the parents, from the father, and you have to talk to the child. And to talk to the child, if a 5-year-old child, 7-year-old child, he requires quietness. He requires a lot of patience. Sit and talk to them, and then counsel them. This, we have a child psychiatrist in Belgaum now. Luckily, he has done DM child psychology. He can't see more than 4 patients per day. Each patient takes around 45 to 50 minutes. Without that, the examination is not complete. Can anyone give that? Pediatrician give? So this is going to be a regular check. Leave about all those things. Leave about the equipment. Leave about the robot. But these are the ones which can be done by talking, by counseling, are going to be the greatest challenges a pediatrician is going to face. So one has to be ready for that. And of course, if you got sufficient number of child psychiatrists, and because of that, sensing this, now NMC also is giving him more and more importance in more psychiatry, and probably in near future, psychiatry will become a separate topic, separate paper, and separate clinical examination. That day is not far off, because people are understanding and people are professing that these things need to be done. Now, the ethical issues involved in the political research, this is another one. Lot of the things we insist the ethics, in pediatrics, that you have to do the research, you have to go on doing research, do the publications, and do the publications in a good journal, and for a good index journal, you require all the criteria to be done scientifically. For that, the ethical clearance is required, and there are a lot of ethical issues which I will not go into details, because the taking the consent from the patients, especially from the child, itself is controversial. Even the judicial system is not clear whether the consent given by the mother for the child's research to be done on the child to be accepted or not. Because you are doing the trial on the child by giving the drugs, and you are taking the consent from the mother. I have no child. Who is the mother to give that consent to the child? So that itself is questioned now. So, but still, these ethical issues are there, but the research has to continue. Now, these are the mathematical modules. Computers, robotic teaching will become the routine already. As you know, almost half of the medical education now is on the computer only, is on the mobiles only, is on the tabs only, and it is on laptops only. So this will continue to increase. And now itself, the notes and the pens, the notebooks, practically will slowly go away. Everything will be on mobile. All the data will be just on mobile. I saw one person other day. He's a corporate hospital person. He is owning around 30 hospitals, corporate hospitals all over India. And all are top-notch hospitals. Top-notch hospitals. And in more than 50% of the hospitals, all the transplant surgeries are going on. He's got the top consultants. Each consultant, he pays around 5 to 10 lakhs. And he's got almost 4,000 to 5,000 staff members working all over, including the manager staff. He is managing all that thing only on one mobile phone. I sat with him for half an hour. He showed me everything. Where is this person is working in which locality? By GPS location, he can say, yeah, this person is there. He's doing his job of the marketing there, because he can't bluff. That just I'm there in Ahmedabad, I'm there in Kolhapur, I'm there in Vijayapur. No. On GPS location, yes, this person is there. He is there in that lane also, including purchase of the equipment, giving us all those 28 hospitals management. He has got all compiled in one this thing. Can you imagine? And I've been to his office in Hyderabad. He's got the people. He's got about 100 people sitting with desktops. And all the material is given there and that is fed to him. So that kind of thing will come. This is for the administration. That kind of thing will come for the management of a patient also. Now the mathematically, there are some modules which have been developed, which calculate the amount of fluid that has to be given depending on the PCV, depending on the fluid levels, depending on the electrolytes. That goes on monitoring. So what is the job of doctor? You say he has got his investigations are so and so, his potassium is so and so, sodium so and so. You put the fluid and then put that machine. It will go on titrating. Yes, he requires so much fluid, so much things. Doctor has probably doctor will not be there, so some attender or some paramedical worker will manage that. So these mathematical modules which are going to be there will manage the patients in future. That is going to be very, very challenging for the doctors, and we'll have to be well versed with that. Now this is limited resources for after having all these things, do they have the money? Do they have the money to do all these investigations? If you see a patient who is admitted to an ICU, even from a middle class family, even from a upper middle class family, he can't afford to stay in ICU, in a good ICU, for more than a week or so. All resources will be drained out. So the pediatrician will have to work against that and see which suitably fits him in investing. And now there are so many schemes have come, and depending on the schemes, you can see one of the schemes which has been now is the government of India's the Ayushman Bharat scheme, where in Belgaum district itself, in last 6 months, almost 1.5 lakh people have taken the benefit of this. So these things should be known to the pediatricians. You can't say, I only know the subjects and I manage. No, you should know the schemes and you should know how to fit him into the scheme, how to activate the scheme, and how to do about it. So these are the things which has to be learned. Managerial skills which has to be learned when you are managing. And the list goes on. One after another, it goes on. Now the question comes, these are all things are there, okay. Now where we are, we in India as pediatricians, as clinicians, we are still in the same old 20 years area. This MGD, the Millennium goals, which was set up in 2000 to have the 2000 health for all. There are 8 goals were there, of which MDG 4 was for the children, MGD 5I was for the mother, wherein you have to bring down the mortality. That was not possible by 2000, so they extended it up to 2015. No, not possible. Now they extended up to 2023. Still not possible, so they may extend further now. So in spite of that, the same old sickness, the same old bad statistics continues in India. The best variant target is almost about 80 to 90, should be 80 to 90% by 6 months of age. It comes down drastically to 26%, leading on to a lot of morbidities and mortalities. Immunization status still lacking almost around 75%. Some places may go up to 93%. Malnutrition continues to be a major problem. Major problem in India. This is the new index which is now said. The IMR, MMR, they are all gone now. Now the global hunger index, which depends on the growth, is disappointingly we are 105th among the 127 countries. We say that we are going to be the superpower. We are the 5th economic power. In another 5 years, we are going to be 3rd economic power. What is the use? If our population is if we are in the in the nutrition status, if we are 105th among the 127 countries, what is the use of becoming fifth or third in this thing country? Sri Lanka has got 80 plus. Sri Lanka is ranked in the 80 plus in the global hunger index. Bangladesh is 103 under global hunger index. The only consideration we can undertake, we can put our color high, is Pakistan is 2 ranks behind, 107. So this is the status which I got. The hunger, the global hunger index. That means we are still in the primitive stage. We are far from the millennium, the targets which have been set up. So we have to be careful, and because of that, now the new thing we've just come in the, you must have read this article, new article which has come the last in Indian Pediatrics by our senior most pediatrician of India, Dr. Ambekar and Samir Dalwai. This is the Evolving Children's Manifesto. That means that you should give the right to the child. You must identify their needs. And we as the pediatricians who are supposed to be the custodian of the children in a holistic way. And we have got the responsibility to take care of them. We have to look after them in all the ways. The health and welfare of children and adolescents, which is the nation's future, must always be the priority of all of us. One would therefore expect this to be reflected in the manifestos of political parties. This article suggests that pediatricians and the Indian Academy of Pediatrics should play a more proactive role in influencing the political parties to commit an inclusive manifesto that addresses key issues related to the child health and welfare. By also liaising and collaborating with other stakeholders such as parents, educators, and child advocates. That means now officially, we as pediatricians, we have got the responsibility, the sole responsibility, the pious responsibility, the noble responsibility to take care of the children. Not only personal capacity, but with unitedly, you must make it a responsibility of the society, of the government, that the children are taken care of. India's children face many daunting problems that adversely affect the impact growth, development, mental and physical health and well-being. For example, 6.1 million children aged 6 to 17 years of age are out of school, and 23% of women aged 22 to 24 years are married as children. And an increasing number of children are victims of physical and sexual abuse, with over 10 million children working as laborers. What are we talking about the Millennium Goals? Additionally, children with disabilities experience barriers in accessing the education, healthcare, social services, leading to exclusion. Now, they say that we should ask the politicians or the government to do these 4 things. One is right to intact survival, that ensure a comprehensive, promotive, preventive, curative, and reliable diet, and make it compulsory for the government to implement it. Right to development. The child has got right to develop in a very holistic environment of both the mental, physical, and spiritual way. Right to protection. This is the most important. Now you must be seeing the newspapers that protect the children and adolescents from exploitation, abuse, and violence through awareness of creation programs, education. Especially I didn't touch the topic of adolescent problems. There's a huge problem of adolescents, and that is the transition period from pediatric to adult. During that time, that problem needs to be attended. Right to participation. This can be ensured through the development of mechanisms to ensure the child's genuine participation in decision-making. Mind you, the children can decide. Don't say that children, he's a small child, he'll not be able to do it. A child about the age of 5 years, 7 years, you tell him correctly, he will make the choice. He will make the choice as to what he wants correctly. So they have to be correctly channelized in that way. So These are the challenges of what I said, that the millennium, the next millennium up to 30th, whatever we want to do, when we go, we have to see that the child should be seen in a comprehensive way, not only curing the diseases or taking care of them, but in a very comprehensive and in a holistic way, so that his development takes place adequately. This is just a sketch of the challenges. The challenges are huge. This is only what I call the tip of the iceberg. But the problems are many, 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 and you face them. So with these things, I stop here. And if there are any points to be discussed, I am open for discussion. Thank you again for giving me this opportunity to work.
Thank you very much, sir, for the very apt talk for the holistic development of the child. So not only the caring and curing of the child, so it is the holistic, comprehensive development of the child. So sir has covered most of the issues. So one is commonly ethical dilemmas. So it's not only grams to graduates. So we have saved. So that should be like, we should not only save the life. ये we save the life. So at the same time, we should look at the holistic care of the mother also. So when we give a CP child to the parents, so their life will be affected. That is one. Second one, so the role of the parents in the behavioral development of the child. So sir has aptly covered most of the issues, because the children always practice what we do rather than what we preach. So the third thing is very interesting. Sir has covered that. So polity is an art and science of policy formulation and policy implementation. That is called Rajaniti. So if the tricks are get involved in it, then it becomes politics. So as we IAPNs, so should get involved in the as sir has done one study. So we should get involved in the policy formulation. So especially like political party manifestos. So if anyone has any questions, sir will be taking those questions. Any questions? Okay, so now we will disperse for the high tea. So after that, there will be installation ceremony. So thank you.
Good afternoon, one and all. Once again, greetings from IAP Vijayapura.
We welcome all the esteemed IAPians and the delegates for the installation ceremony of IAP Karnataka State Chapter 2025 and IAP Vijayapura District Branch 2025.
We request Dr. Parikshit Koti Sir, President IAP Vijayapura District, Dr. Shri Gidaganti Sir, Secretary IAP Vijayapura District Branch, to escort all the dignitaries on the dais.
We welcome our chief guest, Dr. V.D. Patil Sir, Director of New Project Kaher, Belgavi.
We welcome our chief guest, Dr. Baswaraj GV Sir, President IAP 2024.
Dr. S.N. Moti Sir, President IAP Karnataka State Chapter 2024.
Dr. S.V. Patil Sir, President IAP Karnataka State, Chapter 2025.
Dr. Shivanand Mastihoi Sir, District Surgeon Vijayapura.
Dr. Sampath Gunari Sir, District Health Officer Vijayapura.
Dr. Shashikaran KB Sir, Secretary IAP Karnataka State Chapter 2024.
Dr. Sidhu Charki Sir, Secretary IAP Karnataka State Chapter 2025.
Yes, sir.
We request Dr. Ravi Shankar Malpade Sir, President-elect IAP 2026.
To mark the beginning of this inauguration ceremony on a harmonious tone, I invite Dr. Aarti for the invocation song.
महागणपतिं मनसा स्मरामि महागणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दित महागणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दित महादेवसुतं गुरुगुहविनुतं महादेवसुतं गुरुगुहविनुतं वामकोटि प्रकाशं शान्तं महाकाव्यनाटकादिप्रियम् महाकाव्यनाटकादिप्रियं मूषिकवाहनमोदकप्रियं महाकाव्यनाटकादिप्रियं मूषिकवाहनमोदकप्रियं महागणपतिम्
Next, I request our beloved HOD sir, Dr. M. Patil sir, Executive Board Member, Central IAP 2025, to welcome the gathering.
Very good afternoon, respected dignitaries on the dais, and my dear students. It gives me immense pleasure and a privilege to welcome you all for this important day of installation of office bearer of Karnataka State Band for the year 2025. And definitely this event marks a significant milestones as far as the new leadership, new commitment by our new office bearers. At the outset, let me thank our distinguished guests and dignitaries for sparing their valuable time for this installation ceremony. It is an honor for me to welcome Dr. V.D. Patil, sir. And sir is the director for new projects, KLE Belgavi. And sir is the teacher of teacher. And sir has contributed immensely for the medical education and academy of pediatrics. Now may I request Dr. S.V. Patil, sir, and incoming president to honor sir with the bouquet and stole. Now, a special and warm welcome to Dr. Basavaraj GV, National President, and whose exemplary leadership is inspiration for all the pediatricians of Karnataka. And may I request Dr. L.H. Bidri, sir, to honor Dr. Basavaraj GV, sir. And we are honored and privileged to have with us Dr. S.N. Murthy, immediate past president of IAP Karnataka State Branch, and whose guidance and contribution have set new benchmarks for the IAP Karnataka State. Now, may I request Dr. Sidhu Cherki to honor Dr. S.N. Murthy, sir. It's an honor to welcome my teacher, Dr. S.V. Patil, sir, who will be going to be incoming president for the year 2025. And sir, we have got confidence that your leadership will further strengthen our IAP and will bring a positive change. May I request Dr. Parikshit Koti, who is the president of IAP Vijayapura district branch, to honor, sir. It's an honor to welcome Dr. Sivananda Mastivali, sir. He is a district surgeon of Vijayapur district branch, who happens to be pediatricians. And many times, administrator in the government, they will administer because they'll come every obstacle for everything. And another good thing about Dr. Sivananda Mastivali is he's a researcher as well. So whenever we call him on the phone, he will be ready for our programs. So may I request Dr. S.S. Kalyan Setter, Professor of Pediatrics, to honor Dr. Sivanand Mastivali, sir. Now it is honor for me to welcome another administrator, Dr. Sampath Kumar Gunari, who is the DHO of Vijayapur, and who is always helpful in conducting taking all our activities to the community. And may I request Dr. Shri Gidiganti, sir, to honor Dr. Sampath Gunari, sir. Now I welcome Dr. Shashi Kiran, who is immediate past secretary of Karnataka State Branch and friend of mine, and who has given us a wonderful conference at Mysore. And I request Dr. Ravi Bardol, Dr. Basavaraj GV, sir. Sorry, Dr. Basavaraj GV, National President, to honor Dr. Shashi Kiran for his contribution as a secretary for Karnataka 2024. It's an honor for me to welcome Dr. Ravi Shankar Marupalli, sir, who is the president-elect, under whose leadership our IAP will have a bright future. And may I request Dr. Mugli, sir, Srinath Mugli, sir, to honor Dr. Ravi Shankar Marupalli, sir. Now I welcome our young dynamic secretary for the year 2025, Dr. Sidhu Cherki, who will be always on toes. You need not call him, give him a missed call, he will call you. Now I request Dr. Basaraj GV, sir, National President, to honor for his enthusiasm. It is honor for me to welcome Vice Presidents of district different zones, Dr. Mahesh Kore, sir, from Belgaum zone, Dr. Kumar S, sir, from Mysore zone, Dr. Viresh SM from Davargindi zone, Dr. Vinod Uplankar from Kalburgi division, and Dr. Chidanand Enki, who could not come because of some reason, and under whose leadership dedication will ensure that there will be representation from different regions, and you will be the person through which our activity will be rolled out. Thank you for coming here. And I take this opportunity to welcome senior pediatricians, Dr. Srinath Mugli, sir, and Dr. L.H. Bidri, sir, and other senior pediatricians, Dr. Sanjeev Chetty, Dr. Ashok Badakali, and my young pediatrician, both Ramesh Paul and Ramesh, and Elmeri madam, and under whose their experience and excellence and mentorship will go a long way in for the young pediatrician to emulate them. I welcome you, sir. And I welcome our FIP awardees, Dr. Ashok Badakali, sir, Dr. Venkatachalapati, Dr. Basavaraj Patil, sir, for whose contribution have led well-deserved recognition at the national level. I also take this opportunity to congratulate Dr. Srinath Mugli, sir, for the President Excellence Award, and Dr. L.H. Bidri, sir, for Karnataka Rajyotsav Award. And I would like to thank office bearers of different district branches and office bearers of Vijayapura district branch. Your hard work and collaboration spirit are the driving forces behind the success of this conference. And once again, if I left anybody, please forgive me. Because of shortage of time, I could not name each and everyone. With this small introduction, once again, I welcome all of you for this installation ceremony, particularly our young pediatricians, pediatric PGs, our nursing staff, and our pharma students. Thank you. Thank you.
Thank you, sir. I now request Dr. Sidhu Cherki, sir, Secretary IAP Karnataka State Chapter 2025, for the introduction of office bearers.
Good afternoon, one and all, and I humbly apologize for delay in the start of the program. I think we had 8 agendas, but beautiful discussions in the EB. I think we'll be elaborating it in minutes in the coming weeks. Now, coming to the introduction of IAP Karnataka State Branch, State Chapter Karnataka 2025, I request Dr. S.N. Moti sir to kindly hand over the medallion to Dr. S.V. Patil sir. It will be one more time we are doing it, sir, as a signature, just for memories. So S.V. Patil sir has officially taken charge as President IAP Karnataka State Chapter 2025. Last. And the president-elect will be Dr. Ravi Shankar Marbali sir. I think already we have greeted you. We welcome you to the office, sir. And Dr. Abhishek Fadke will be the treasurer 24-25. I request Dr. S.V. Patil sir and Basara GV sir to kindly felicitate Dr. Abhishek Fadke. Sir, please. And S.N. Moti sir as well. Now I call upon Dr. Venkatachalapati sir, Joint Secretary License. Sir, welcome to the team, sir. I request S.V. Patil sir and Basara sir and S.M. Moti sir to kindly do the honors for all the members, sir. We have national president, guys, and past president and the coming president. Dr. Sinchna Bhatt is not with us here. No. Moving on to the vice presidents, I request Dr. Mahesh Kori sir. Sir will be the vice president for Belagavi zone. I request Dr. S.V. Patil sir, Baswaraj sir and S.N. Moti sir to kindly felicitate. I request Dr. Kumar S.R., our dynamic neonatologist, pediatrician, wholesome IAPN of Hassan branch, and student of disciple of Baswaraj GV sir. Kumar sir, welcome to the group. Now I request Dr. Veeresh SM sir. Sir will be the vice president for the Davangere zone. So we welcome you to the team, sir. Dr. Vinod sir. Sir will be the vice president of the Kalburgi division. Sir, we welcome you to the team. Last name. Dr. Chidananda NK sir is the vice president of the Bangalore zone. Sir has expressed his inability to attend the program. Thank you, Basara sir. Thank you, S.N. Moti sir. Thank you, S.V. Patil sir. We also have the installation ceremony of the IAP Vijayapura district branch. I request our beloved senior pediatrician, Dr. V.D. Patil sir, and Dr. Shivanand Mastevali sir and Ravi Shankar sir to kindly do the felicitation. I request Dr. Parishit Koti sir, President IAP Vijayapura district branch 2025 to come onto the dais. I request Dr. Srishal sir. Sir, Srishal sir will be taking charge as Secretary of IAP Vijayapura District Branch 2025. Dr. Ravi Badol, sir, will be the treasurer of IAP Vijayapura District Branch 2025. Sir is a senior pediatrician of this part of Karnataka. We welcome you, sir, for the team. Yeah. Thank you, Vidi Patil, sir. Thank you, Sivanand, sir. And thank you, Ravi Shankar, sir. I just got to know from Shashi, I'm learning from him a lot. There is a symbolic handover from the secretaries as well. I was not aware of it. So he wants to give certain burden to me. Especially the financial, which he has set a trend mark. I should make a mark of it. Carpedicon 2024 has contributed 4 lakhs rupees to the IAP corpus. It is the first of its time. I think kudos to Moti sir and Shashi and all the team members of Carpedicon 2024. That is a huge baggage, Shashi. I'm scared now. Thank you, one and all. We would like to work under the leadership of Dr. S.V. Patil, sir, as the president, and Dr. Ravi Shankar Malapalli, sir, as the president-elect, under the able guidance and supervision of Basavaraj, sir, Srinath Mugli, sir, and L.H. Bidri, sir. And I think now we'll move on to the inauguration by watering the plant. I request all the dignitaries to come onto the dais, please. Thank you, sir. Thank you.
Thank you, everyone. I now request Dr. S.V. Patil sir and Dr. L.H. Bidri sir to felicitate the chief guest of today's program, Dr. V.D. Patil sir, Director of New Project Kaher, Belgavi.
I request Dr. S.V. Patil sir to felicitate Dr. Basavaraj G.V. sir, President IAP 2024.
I request LH Bidri sir to felicitate Dr. SN Moti sir, President IAP Karnataka State Chapter 2024.
Thank you, one and all. I request all the dignitaries to sit down on the chairs and dais. Next, I request our chief guest, Dr. V.D. Patil, sir, to say a few words.
Good afternoon, everybody. Respected dignitaries on the dais, the President of the IAP 2024, Dr. Basavaraj, Yogesh Parekh, Dr. S.N. Moti, Dr. Shashi Kiran, Dr. Shivananda Mastivali, Dr. Sampath Gunari. Today's the central point, Dr. S.V. Patil, Dr. Sidhu Charki, Dr. Parikshit Koti, Dr. Shishal Girnati, Dr. Mughali, Dr. L.H. Bidri, all the senior pediatricians of the Vijayapura and Bagalkot district, invitees, ladies and gentlemen. It gives me great pleasure to stand before you on this very auspicious occasion of the installation ceremony of one of my best student, Dr. S.V. Patil, who is taking the reins of the president of the prestigious IAP of Vijayapura district. I wish Dr. S.V. Patil and his team an extremely memorable next 1 year and do the work, because Dr. S.M. Moti and Dr. Shashi Kiran have set very high benchmarks, and it's not an easy task to go near them and cross them. But I'm sure the team is so good, Dr. S.V. Patil and Sidhu Charki, that they'll be able to do the justice, and they will carry on all the programs which have been given by the IAP. In addition to that, they will have their own programs. And today, one of the programs which we initiated is the planting of a tree. That's a very unique one from the point of view of the pediatrics. I don't know whether you have seen that one of the video which has been circulated. In one of the Rajasthan village, one lady medical officer, she was posted there. She got a message from the hospital that a woman is being delivered. So she rushes there. She herself is pregnant. She goes there. The baby is delivered. It's a female baby. And she comes out of the labor room and sees that there's a huge crowd of villagers with all the sickle, with all the sticks and all the instruments. She was horrified. And in between them, one of the person, a leading person, the village mukhia, He walks. He comes and snatches the baby and starts going out. The lady doctor questions him, why you are doing this? He looks at her and just walks, goes and stands on this something like a podium there. And from the village, from the villagers, one of the person brings a plant this thing, something like this, and gives to the mukhya. Mukhya takes it and just do the puja of the baby with that plant and gives it back and tells to the little doctor that you were scared that I would do something for this baby. No, this is an honor we give to every newborn female baby. The plant is given, and similarly, 11 plants are implanted surrounding that. As I said, there are thousands of plants which have been implanted in this surrounding area. And his work has been recognized by even the UN and WHO, and they have given a 3-kilometer water pipeline from the nearby water source to plant these villages. So such a noble thing which has been done, that this is a symbol that we take care of our children, we take care of our babies. So I hope that it will be implemented in the true spirit. I have no doubt that Dr. S.V. Patil and this team, because there are lot of good schemes which have been coming up from the IAP. Year by year, newer and newer schemes are coming, newer projects are coming, and all those projects need to be implemented with the true spirit and with commitment and dedication, and not for just for the sake of completion's sake. So you must involve all the people, you must involve all the stakeholders, not only the pediatrician, the fellow doctors, the other paramedical workers, and the governmental agencies. And we have got excellent support from both the district surgeon and the DHO. So I'm told that both the deputy commissioner and CEO, both of them have actively promised to participate in all the programs and support them. So I'm sure that the activities will be carried on very well. I wish you all the best, and thank you once again for inviting me. Thank you.
Thank you, sir, for your wise words. I now proudly request Dr. S.V. Patil, sir, President IAP Karnataka State Chapter 2025, to deliver Presidential Action Plan.
Good afternoon, dignitaries on the dais and off the dais. I sincerely apologize for the program running little late. As we embark on this journey, I am honored and privileged to have my teacher, Dr. V.D. Patil, on the dais, giving me his blessings to go ahead with my mission. So also with Dr. G.V. Basavara, sir, who happened to be with me closely associated in the last 2 years, one call away for many of the suggestions and advice. And already the tenure has not yet begun. Sir has helped me a lot in framing the team, Karnataka state team, keeping in mind the diversity, the zone-wise, the VP selections were all done in a team in concurrence with the Honorable Dr. G. Basaraj, National President, as well as Dr. Santosh Sohan, sir. And so also the EB elections were also done in a very healthy manner, and it's very nice. We had a very nice program to felicitate and congratulate all VP and EB members. Once again, I welcome to all this installation ceremony. The action plan for this year would be in concurrence with the national goals which have been sent for the present President 2025 by Mr. Vasant Khalatkar, wherein enormously the basic care, the main goal would be the prevention of childhood mortality below 5 and infant mortality rate. Childhood mortality by making an effective outreach programs, reaching the peripheries by way of many things. One by immunization, number two by promotion of breastfeeding, number three, prevention of malnutrition as well as malnutrition. So these have to reach the periphery by various human resources. The reason being, gone are the days where we used to personally interact, orient, give handouts, give an orientation talk, speech, etc. to the various rural centers. But now it is a digital platform, and as rolled by the national president, it is through the digital platform where the today's drive is towards watching the reels which are more informative. So as per the programs, we are reaching the outreach by various preventive promotions and outreach extension activities, immunization drives. And in immunization, we are going to see that it is completely primarily immunized by all essential vaccines, and see the hesitancy of the patients where it has been met with the sending of the message through the digital platform. And already the district administration is with the immunization role. So this is going to be strengthened more at all the periphery and all even the establishments across the city. So this is what we have taken as an national plan, which gets aligned with the national role. Along with that, the honors what we have again. So this is symbolically, we shall represent IAP Karnataka State Chapter logo everywhere in meetings, wherever we attend. Probably this is my humble request, where we can meet and we can share the code where across the state. This was one of our team IAP has thought of making it the known towards across the state. And we have adopted two of the some best practices. Number one, we all know the doyens of pediatricians, Dr. D.G. Venkappa, Dr. H.E. Desai, Dr. Nirmala Kesri, who have been the founders of Pediatric Society in the entire nation and in the state. So also once the young people are coming across and has been inducted, various presidents and the EBs and even the students where have been inducted for the national programs, it is my feeling that they also should know the teachers and who have made the pediatric specialty a real attractive specialty across the zone. In that concern, I have arranged a display wherein the doctors of Gulbarga, Dr. Veerbhadrappa, Dr. Gachinmani, their biodata has been displayed. From Belgaum zone, Dr. V.D. Patil, who was the pioneer in setting up a pediatric practice at Belgaum. Vijayapura, Dr. L.H. Bidri. Hubli, Dr. Srinath Mugli. And Bangalore, Dr. D.J. Venkappa, and as well Dr. Basaraj sir also. So we as an newly inducted bearers and the forthcoming, we have to grow the stem and make the stem stronger so as to know these pediatricians, these honorable pediatricians who have taken the Indian Academy of Pediatrics of Karnataka State to the pinnacle, or whatever they call it as an epitome of Indian Academy of Pediatrics Karnataka State Branch. So this is what we have rolled over for our action plans. And one more thing which I would like to just put it as, the vice presidents will have a special role in monitoring the academic activity zone-wise, or else it could be district-wise. The IAP modules, which have been begun by Dr. Honorable G.V. Basaraj sir, which shall be continued with the national president, and these shall be monitored zone-wise by vice president, wherein all modules reach to all the districts and monitoring and academically has been done. And these shall be done by way of making reels or shorts, which is the main attraction in the today's life. And the best 100 reels shall be selected for the national zone. And from our pediatric society also, the top 3 or top 5 reels shall be awarded from Karnataka State Branch as the best outreach extension as done before. So these are some of the activities, and of course, the childhood development screening program and growth program are also in place. And the special task which we have taken from IAP Vijayapura is about the bringing down the infant mortality rate. Many meetings have occurred with Dr. District Surgeon and District Health Officer, wherein our infant mortality rate is around 9%, if I am right, 9%. And Deputy Commissioner and CEO, CS of ZP have appealed us. We are all with you in way of public-private partnership. Put all the efforts, build up a team at the Vijayapur as well as periphery in salvaging the child in early. So in this regard, we have taken an project. We have taken a project which runs as a TOPS project, wherein neonates, the transfer of neonates from the periphery to the tertiary care is taken care of. It runs as TOPS project. T for temperature, O for oxygenation, P for perfusion, S for sugar, hypoxemia, hypoglycemia, hypothermia. And these things have to be maintained for a baby which is being referred from the tertiary, from the periphery to our tertiary care, or else train the skills and upgrade the workers, healthcare workers working at the periphery, so as to stabilize the patient there only at their center with our team, stabilize the first golden minute, first golden hour is met, and 24 hours the baby is secured, and then transferred to the tertiary care for better thing. And once it reaches us, it is a safe infantry. And of course, we shall be monitoring later for next immediate ROP is another line we are thinking of where we can run. And in this regard, we have an just an talk with the district hospital where we shall be dealing with these preventive aspects of newborn infant mortality rate as well as the comorbidities that come in neonatal. So these are some things. This is a pilot model project which we are trying at IAP Vijayapura, and already we have a database of around 100 plus, sorry 500 plus, and this, if implemented, should be an ideal project across the state, bringing down the infant mortality rate to a greater extent. So with these action plans, I once again appeal the IAP Vijayapura and IAP Karnataka State Branch, and of course the leadership of J. Basavara sir and now Dr. Vasant Kalkar sir for hand-holding and guiding us to achieve at least the 80% of the target which have been set by us, and we shall be successful in reaching the target as well. So without wasting much time, I shall just conclude my remarks with this note that we'll all work together, we'll all grow together, and we shall reach to the Mysore landmark which they have been set, and we shall try and strive hard to reach and to their expectation. Thank you one and all.
Thank you, sir. We will definitely try to meet your expectations and help you out in this, sir. Next, I would call upon our very own Dr. Sidhu Charki, sir, Secretary IAP Chapter 2025, to felicitate dignitaries of Karnataka State Chapter.
I think we have very eminent personalities among us who have achieved a lot in last year, 2024. To begin with, our own Srinath Mugli sir. Sir is a backbone of IAP North Karnataka, Karnataka, India as well. I'll start from that. Sir has received a special Presidential Excellence Award from IAP India, which sir is going to be given in 2025 January, Pedicon. I think we are blessed to award you prior to that, sir, before the award itself. Kindly, I request all the dignitaries and to the dais to felicitate Dr. Srinath Mugli, sir. I request everyone to stay back. We have our own LH Bidri sir, who has been given conferred Rajyotsava Award 2024. Sir being a pioneer, a doyen of North Karnataka, Karnataka, India. Sir, we are lucky to have you among us. Hearty congratulations, sir, from IAP Karnataka State Chapter and IAP Vijayapura District Branch. Now I request our FIP awardees to start with Dr. Ashok Badkali sir, Dr. Venkatachalapati sir, and Dr. Basavaraj Patil sir to kindly come onto the dais. Shishal sir. Two more chairs. Two more chairs. Shishal sir. Yeah. FIP award is Pedicon 2025. Take all three.
Thank you, Dr. Sidhu Charki. I now request Dr. S.N. Moti sir to say a few words.
Good afternoon, everybody. Dignitaries on the dais, and then recognizing the presence of all the luminaries in the Pediatric Academy. I must tell you, right from the time I arrived this morning, everything that you people did, IAP Vijayapura, under the leadership of Dr. Patil, Dr. Sidhu Charki, the turban, then endowing with such beautiful sentiments, all these denote our tradition, our values, and your love and affection. I'm very sure we'll all feel very happy and very proud that you will set this beginning and take it forward to a greater glory in the year to come. And I must tell you, Dr. Basavaraja, you were so busy throughout the year. There was not an occasion where a call was not returned, no matter which hour of the day or the night. No, this year he'll be more available because he is actually laying down the office as the president, and I'm very sure he'll do greater hand-holding for you. And I must say, when I took the charge, I just assumed a responsibility of 3 points during our tenure: awakening, academics, and advocacy. Academics and advocacy was done in plenty by our national president. So we just restricted to awakening. Keeping this in mind, we traveled over 22 districts of the Karnataka state so that we could enthuse our youngsters, younger pediatricians, to take the academic work in the time to come, so that they need to be more forthcoming for the academy to grow with newer ideas and newer concepts, so that it is your academy which we'll take the back seat and watch how you really take it to next level of glory. And I also had pledged that I'll not lead from front, because many a times whoever leads from front, when he looks back, there may not be any followers. We pledged that I will lead from behind, so that I can create more leaders. That's how I was able to create leaders like Dr. Shashikiran and Dr. Srinivas and our whole team of active pediatricians in the district branch of Mysore, who were able to identify, rediscover their passion, and are able to take it to another level. And I still remember Dr. Amaresh Patil, I asked, what shall we coin a good Kannada term for our banquet? Then I asked him, ಜೊತೆಯಲ್ಲಿ ಅಂತ ಇದ್ರೆ ಪರವಾಗಿಲ್ವಾ ಸರ್, ಸುಂದರವಾಗಿದೆ, ಅದನ್ನೇ ಮಾಡೋಣ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. What I felt, the phrase ಜೊತೆಯಲ್ಲಿ denotes strength, it denotes commitment, it denotes solidarity. Let's always remember this, and we'll walk hand in hand in the time to come. And I wish, Dr. Patil, you will take the academic work to real levels of glory, and Sidhu Chaki hand-holding and the entire team, and your admin backup, like the DHO and the district administration, DC, all of them chipping in. There are so many national programs which can really be carried forward with greater emphasis. I'm very sure will bring about a meaningful change in the child survival across the state and the whole country. Thank you very much for your time.
Thank you, sir. Next, I would like to welcome Dr. Athana Badra, sir, Treasurer IAP, who is joining us on online basis to deliver few words.
Thank you. And I am honored to be invited to the installation ceremony of IAP Karnataka State Branch. Congratulate Dr. S.B. Patil sir and Dr. Sidhu Chatti to taking charge of one of the most prestigious state branches of the country. They have the Karnataka State Branch is, we always look forward to Karnataka State Branch for carrying out the presidential action plan and the whole program of the IAP. So in fact, they have contributed much to whatever IAP has become today, especially in the last 2 years during the leadership and mentorship of Dr. Basavaraj sir. It has played a vital role. I thank and a very good job, well done by Dr. S.N. Moti and Shashi Kiran, who had been the president and secretary of the Karnataka State Branch, just handing off their charges. We were fortunate to have their hospitality in Mysore when you had an executive body meeting, CIP EB meeting at Mysore. And I'm thankful to them, a sentimental relationship, because that's where Calcutta was awarded the IAP Pedicon in 26. I welcome all of you, all the members, to be present in IAP Pedicon in 2026 January. And I know the vital role that has been played by many people, of many of our office bearers, past, present, and future, the different district office bearers, and especially the CIPB members. I welcome Dr. Nandish, Dr. Sri Krishna, Dr. Mallan Gowda sir, Dr. Durgappa sir, and Dr. Shiproka Sosale, who will be playing their pivotal role in the CIPEB this year. And thank you, all of you. I'm sorry to join you on an online mode because I'm traveling to Hyderabad. I could not make the itinerary that could touch you, but I'll assure you that it's almost, Karnataka is almost my second home. Again, in the next week, around 18th, I'll be in Bangalore, and I'll try to come to Vijayapura branch whenever possible during that year. Thank you all the dignitaries and all the members for inviting me. Thank you, sir.
Thank you very much, sir. Next, I would like to call upon Dr. Basavaraj GV, sir, President IAP 2024, to deliver few words.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. Respected dignitaries on the dais, our teachers of teacher, Dayan in the field of pediatrics, mentors to many, and his contribution to the IAP Karnataka State Branch is immense. Not over years, over decades, sir has contributed immensely to the growth of IAP Karnataka State Branch, not only guiding, mentoring many of the presidents of Karnataka and 2 national presidents in recent times, Santosh sir and myself, with his blessings, with his guidance, with his support. And Dr. S.V. Patil sir has chosen a right person, not only as a teacher, but looking at a contribution of a work of sir is something which everyone has to learn a lot from, how silently we can do a constructive contribution to the organization. So you have chosen a right person on this occasion, sir. And IAP Karnataka state branch, which is always a unique and it is always contribute immensely to the national level. I'm sure the present team led by Dr. S.V. Patil, sir, Dr. Sidhu Cherki, who has been already shared their vision and what really they're planning for an academics, administration, and the reaching to the community, and especially the moment they said about neonatal mortality and infant mortality, without the contribution of a government agency, it is a very difficult task. And I am sure Dr. Shivanand sir and Dr. Sampath will work hand in hand with our IAP Karnataka state branch. That will definitely makes a big contribution to the society. Thank you very much inviting them and also moving along with that. And our IAP Karnataka state branch, which has been mentored by past president like our Srinath Mugli sir, our chief election commissioner also in the past, Dr. L.H. Bidri sir, Dr. Sharan Gowda Patil sir, and of course, Pana Purmat, Dr. Veerbhadra Pasar, Shivanand sir, Dr. H. Parmesh, all of them have contributed immensely, where the new team, which has been assisted by our Vice President like Dr. Mahesh Kore from Belgaum Division, Dr. Vinod Upalankar from Kalburgi Division, Dr. Veeresh, Dr. Kumar, Dr. Chidanand, and our Joint Secretary, Dr. Venkata Chalapati, and our Treasurer, Dr. Abhishek Padike. Their input, their contribution is going to make a big difference, and also it will be the one of the most memorable year in the 2025. On behalf of Central IAP, I'll assure you, and our Secretary General supposed to be here yesterday, Dr. Yogesh Parikh was there in Hubli because of an urgent call from Hyderabad, Pedican. He left there, and our Honorable Treasurer is already addressed along with Dr. Vasant Kalatkar, all the program of Central IAP, which is going to be definitely in this year also. We will assure you and we will all work for that. And in the year 2024, Dr. S.N. Moti sir and Dr. Shashi Kiran, along with the others, like Dr. Gururaj sir, Dr. Srinivas, and our EB members, Dr. Amrish Patil, Dr. Sanjeev Chetty, Dr. Venkata Chalapati, Dr. Priya, Dr. Adarsh, all of them immensely brought many of the program, and where our IAP Karnataka has been recognized as the best branch in the country. So I'm sure this new team will also achieve that with doing a good work in that. And we require a lot of local support and medical colleges. That's a very, very important thing. With an HOD, Dr. M.M. Patil, not only executive board member, and also the head of the department of our BLDE Medical College, will carry out along with the S.V. Patil sir, he happens to be his teacher. So they will all contribute immensely with the local branch, Dr. Parikshit Koti, Dr. Srishal Gidgante, Kalyan Shettar, and all. They will all contribute because local branch support is very much required. Unless we involve them into the things, and you can see the testimony to that. Dr. S.V. Patil sir invited all the branches to the installation and conducting this installation in a very, very meaningful way. So that shows that already the well began, all up done. That shows that Dr. S.V. Patil sir is inclusiveness and taking the IAP to the nook and corner of our state. And Indian Academy of Pediatrics always recognizes the work which has been done by whether it is a local branch, whether in the district branch or the state branch at the national level. You can see lot of things has been recognized in this year. So to start with Dr. President's Excellence Award
Dr. Srinath Mugli sir been awarded for his rich contribution to the IAP, and FAAP, Dr. Venkatachalapati, Dr. Basraj Patil, Dr. Ashok Badkali, and of course, others also have been awarded. And I'm sure all your work, which will never go unnoticed, it will be recognized in one or the other way. So I'll tell you the truth. Once there was when I stood for the secretaryship, there was a little controversy, was there something. The immediately I called Vanapur sir called the VD Patil sir. The matter is solved within a few minutes without anything. Our seniors are so always affectionate and solving all the issues and guiding the youngsters to do the good work. What is required, we have to do honestly and credibly, so that our seniors is always there for us to guide in all the things. So that is with these few words, our Ravi Shankar Marapalli will be taking over in the 26, and you'll be working hand in hand with the Dr. S.V. Patil sir. So definitely we'll all work together to make the IAP of Karnataka as a big name at the national level, which has been already been done by our seniors. We will maintain that, or we'll take it to the other level. With these few words, once again, thank you very much for inviting me to share my few words. Thank you.
Thank you so much, sir. Next, I would like to call upon Dr. Sidhu Charki, sir, to make a small announcement.
Sir, with the permission of the President, sir, and the President-elect and all the dignitaries on the dais, I just got a news from our one key, sir. Dr. B.C. Elimeli ma'am has been announced as the State Ambassador of Baby Friendly Hospital Initiative. Hearty congratulations to you, ma'am. We request you to commonly come onto the dais. I request our dignitaries to kindly felicitate, ma'am. It's a great moment for all of us as IAP Karnataka State Chapter. Sir, SP, sir. State Ambassador of Baby Friendly Hospital Initiative, sir. Karnataka State Chapters. Please.
Congratulations, madam. Next, we have a small message from Professor Dr. Yogesh N. Parikh, sir, Secretary General IAP. The message reads, "Good afternoon, respected seniors and dear friends. Namaskar. Respected dignitaries on the dais, esteemed members of IAP, invited guests, and my dear friends, beloved President Dr. G.V. Basavarajan, sir, Dr. Srinath Mugli, sir, Executive Board Member Dr. M.M. Patil, sir, and all. It is an honor and privilege to all of you today on this auspicious occasion of the installation ceremony of the Karnataka State IAP Officer Bearers for the year. I extend my heartfelt congratulations to Dr. S.V. Patil, sir, the incoming president, and Dr. Sidhu Charki, sir, the newly appointed Secretary of Karnataka State IAP and Team 2025. Thank you. Dr. Yogesh N. Parikh, Secretary General IAP of Pediatrics.
I now request Dr. Parikshit Koti, sir, President IAP Vijayapura District Branch, to give vote of thanks.
Good afternoon, everybody. On behalf of IAP Vijayapur, I'd like to thank Dr. V.D. Patil, sir, Director of New Project Kaher, who have been instrumental in delivering his guest talk. And I think his words will inspire the future pediatricians of this part of the Karnataka. And I also thank Dr. G. Basavarajan, sir, under whose able presidentialship, IAP, Central IAP, as well as Karnataka has been awarded as the best state branch. I think Dr. G. Basavarajan, sir, will continue to guide us in the future endeavors. And I, from the bottom of my heart, for the past, that is Karnataka State Chapter 2024. I'll always remember Mysore for conducting Pedicon, SN Moti sir as well as Shashikiran. I'll always remember they have set a benchmark which should be a mark to it. I think Shashikiran will definitely help us not only in handing over his burden to excel to that level. And under able leadership of, I also thank Dr. S.V. Patil sir, under whose president of IAP, Karnataka will achieve new heights. And not to mention Dr. Sidhu Cherki will definitely work towards that as accepting as this one. And myself, I think I'll be a treasurer for 2024. I'll be very tough with this, Sidhu, for you. Because we have to contribute minimum. That's what Dr. L.H. Bidri sir told. We don't want a state Pedicon not to contribute to the state, this one, the state IP fund. We'll see to it that in the next. And I also thank Dr. Sampath Gunari sir and Dr. Mastiwali sir, who are definitely instrumental, and whatever our IIP presidential plan Dr. S.U. Patil sir has dreamed, I think it will not be executed without involvement of our Mastiwali sir and Sampath Gunari sir. And we'll always look forward to your kind cooperation in this one, sir. IIP will always thank you for that, sir. And I also thank Dr. Ravi Shankar Marpalli, sir. I think who will be continue whatever has been taken now, and will take guidance from Dr. S.V. Basaraj sir and S.V. Patil sir, and with the able partnership with Ravi Shankar Marpalli, will be able to take IIP Karnataka to newer heights. And I also thank Vice Presidents of different zones, that's Mahesh Kore sir, Kumar sir, Viresh, Vinod Upkalkar, and Chidanand sir, as I always, and also Abhishek Padke sir, Venkatachalapati sir, and L.H. Bidri sir, and all the dignitaries of the dais for gracing this occasion. Not but the least, special thanks to the organizing team led by Dr. Pooja and the IT department. And also I thank all our colleagues who have been instrumental and who could attend this in short notice, and all the nursing staff, and all, sorry if I failed to mention many of you who have been instrumental. Oh, yes, yes. Without, yes, please.
Sorry for intervention. Respected dignitaries around the dais and after dais, sir, last year we have got more than 60 cases of diphtheria in my district. Out of the 3 deaths were there, thanks to Dr. L.H. Bidri sir, who is my guru also. Since 30 years, I'm working under him for all national programs. So in that aspect, we did all training, talukas, everything. Out of 314 sanctioned ANM or immunized staff nurse who were doing immunization, 127 vacancies are there still. So for the last 3 months, as I've taken charge 3 months back only, not even a single diphtheria death has been occurred. And out of this 60 diphtheria cases, 46 were admitted in our district hospital, sir. 46. Out of the 60 diphtheria, 4 are from out of districts, 56 are from our districts only. Only we have lost that to most interior border of Gulbarga and unable to give ADS in that time. So, unfortunately, we lost the 3 lives. Hope this will not continue again. And again, same. We are doing micro planning along with L.H. Bidri Center. Hope Dr. S.V. Patil also will add in this, will continue in this work along with DC sir, as I already talked. So I want nearly HR, little bit HR and all other diagnostic, and hope our pediatrician private hospitals start immunization drastically, sir. Now I have taken a plan of catch-up immunization only for DPT. And of course, Penta will be given within 1 year, maximum 24 months. So after that, up to 7 years, I have started giving DPT for any child, irrespective of taken at its dosage. I have started this program. Our staff is doing, sir, at present. So in this again, we have got shortage of action. Again, we talk to the state. They will be supplying in the next week. I think this is an example of good governance and administration, not ad administration. Thank you. Hope you will all help. Thank you. Thank you very much.
Channeling with your thoughts, that's what our presidential action, Super sir told, will be taking up more on vaccine preventable diseases and complementary feeding to prevent malnutrition, which has been in channeling with the central IAP action as well. That's why involvement of government bodies is equally important or much more important than our thinking. And also special thanks to organizing team led by Dr. Pooja and also IT department of BLD who has been kind enough to provide us with this. I think with this, we'll break for the lunch.
There's a small announcement, sir. IAP Kalburgi branch would like to felicitate, like IAP Kalburgi sirs are Dr. Vijay Shekhji sir, Dr. Sharan Gowda Patil sir, Dr. Baswaraj Patil sir, Dr. Sanjeev Chetty sir, Dr. Vinod Uplanka sir, Dr. M. Patil sir, and Dr. Kalyan Shetty sir. They would like to felicitate Dr. Basvarajan sir, S.V. Patil sir, and S.N. Moti sir.
Okay, okay.